morning. My name is Dr. Kathleen Kendall-Tackett, and today I'm going to talk to you a little bit more about some of the risk factors that are involved in perinatal trauma. Well, when we're talking about anything like, around the perinatal period, one of the big risk factors for how a woman's going to feel is whether she felt safe or whether she felt she was in danger. And it's amazing actually how common this theme comes up with mothers. Talking about, being really afraid. They were afraid that they were going to die. They were afraid their babies are going to die. And we find that even if it's, quote, not medically true, that we, still can see an effect of that. But oftentimes it is something. There's something that has, kind of triggered and made this situation seem dangerous. And so oftentimes the mothers experience this as overwhelming fear and helplessness. And unfortunately the hospital environment in itself is, kind of designed in a lot of ways to really be disempowering. It's like others tell you what to wear, what to eat, when to go to the bathroom. And so again, the hospital environment itself tends to kind of just promote this just by the nature of it. And oftentimes, women going in for a birth, it's the first time they've ever been in that kind of setting. So helplessness is a real common. Also loss of control. Now loss of control can be of loss of control of the situation, but also it's amazing, one of the things that tends to be rather shaming for women is feeling like that they lost control of themselves, that they didn't behave in a, quote, dignified fashion. So again, that could be a theme you a lot of times hear moms talk about. Also the perceived level of care. We're going to see that this is huge. And I think that this is what we're seeing in the data is really suggesting that we need to have a fundamental rethink of the American maternity care system, just based on what mothers are saying about it. Also to their level of power and control. And again, that's very predictive. Okay, now in a study in Sweden, you can actually see, again, kind of some similar things. Now remember, if you remember from the previous module, Sweden is one of the places where, births actually were really pretty good, but they're not always perfect. And so again, this is kind of a follow-up of looking at 42 mothers who had post-traumatic stress symptoms. And so here were some of the things that they noted. Okay, so again, this first one is nervous or non-interested midwives. Okay, we're going to see that the behavior of the healthcare provider turns out to be kind of rather important. Also, feelings of intense fear or feelings of shame during delivery. And actually that's one of the things a good birth attendant can do is actually help mothers sort of reframe some of the events during birth. And so again, like I said, this is a kind of a factor. But also lack of postnatal follow-up. Oftentimes, even when mothers have experienced, objectively life-threatening births, they're often sent home as if nothing happened. And so again, that can be very troubling. But also long-term postpartum fatigue. Again, like I said, if a woman's had a kind of a traumatic delivery, chances are she's not sleeping very well. And so she's going to probably be more tired than the average new mothers. And also inadequate help from their partners. And they said in this particular study, 1/3 of the mothers actually feared for their babies' lives. So again, I said that danger element kind of comes up over and over. Now, this is one of the papers that I thought actually was particularly disturbing. It's what's known as a meta-ethnography, which means they took the results of 10 qualitative studies and combined them. Okay, and what they found actually is, first of all, again, the healthcare provider had a key role in being a person who kind of facilitated trauma. But also, something to kind of remember too is, that the same healthcare providers can be the ones that really limit the impact, of a negative experience. And so this is something especially when I speak to nursing audiences, always kind of mention. Okay, but this is what the mothers were reporting, that the care that they received was sometimes experienced as dehumanizing, disrespectful, and uncaring. Again, that's a very troubling kind of thing, because again, like I said, what other aspect of healthcare could we find actually that would be still a type of way people act? Okay, so here's actually what the women said. They said that they were more likely to describe their births negatively if they felt invisible and out of control. And these are the words that they used. And I just think, again, this is just amazing to me, because again, what other parts of healthcare could we have where people describe their experiences in these terms? Barbaric, intrusive, inhumane, and degrading. Okay, also too, women were distressed at, having people that they did not invite to watch their births in there watching their births. And I've often said, especially about, thinking about abuse survivors and going into, a childbirth setting, that I think actually probably one of the worst places that they can give birth is a teaching hospital. Because again, you have very little control. But mothers, even without a trauma history, were finding that one troubling. Okay, also felt powerless and out of control and vulnerable about decisions about their care. We talk a lot in healthcare settings about making informed choices. Well, the women actually felt like, first of all, they felt betrayed by their healthcare providers. but they also felt really coerced into experiences, or into interventions that they didn't want because they just wanted to make it stop. Okay, so again, it was not really giving informed consent. It was more a matter of they just needed it to go away. So they agreed to things like epidurals and vacuum extractions in an attempt to experience the trauma that they were experiencing. So again, that's a very kind of, I think, troubling thing that people are reporting. Now, another factor, of course, that can lead to childbirth being traumatizing is if the couple has had a prior perinatal loss. Now, the reason I said couple is because we're actually finding very similar results for both mothers and fathers. So if they've lost a previous baby, particularly if they had something like a late miscarriage, if they've had a stillbirth or a neonatal death, being back in that same situation is going to be very, very triggering. There was one study where they were looking at ultrasound after couples had had a previous perinatal loss, and finding actually that ultrasound was extremely triggering because the last time they were there, that's what the couple said. The last time they were there, they were finding out that their baby had either died or was dying. And so again, recognizing that these medical situations can be very, very highly triggering for couples who've had that kind of loss. In this particular study, they looked at 36 couples, and they said not only did prior perinatal loss increase the risk for PTSD, but it also increased the risk for both depression and anxiety. Okay, and so again, these persisted actually through 8 months postpartum. It started during a pregnancy, and they said actually that PTSD remained in the moderate range throughout. And again, this is a group of parents oftentimes who were very vulnerable to PTSD. So again, a group of parents we need to watch. Also, high risk of depression, and as I mentioned before, very similar rates for mothers and fathers. Now, another group that tends to be at very high risk for post-traumatic stress disorder and also acute stress disorder are parents who give birth to preterm babies. Okay, and the sicker and the smaller the baby, the more likely the symptoms. I remember one study looking at a NICU sample and finding somewhere in the neighborhood of 40% of the mothers had acute stress disorder. So again, population with very, very, very high rates. This was a study from up in Canada looking at VLBW as very low birth weight. Okay, so those are babies under 1,500 grams. Okay, and actually now we're gotten to the point where we actually have extreme low birth weight, babies. And so these babies are surviving as well. And those are babies tiny, tiny. I think they tend to be around 800 grams or lower. And so again, very, very small. Finding actually that those mothers actually also are in the clinical range for PTSD. So a high percentage there, 23% in this study. And not surprisingly, the sicker the baby, the more likely the mother was to have symptoms. Okay, now what about a history of sexual trauma? Again, we would kind of suspect that mothers that come into the birth with a history of sexual assault or sexual abuse are going to be more likely to experience their birth as traumatic, unless there's some kind of specific steps taken to safeguard that mom. And not every study has actually found that, but this was actually one that did. And again, it's kind of like in the direction that you would expect. So they said women who had anxiety in pregnancy or a history of sexual trauma were more likely to develop PTSD after birth. And so again, you can see that it's not nearly as high as it is for the moms who have babies in the NICU, but 5.6% met full criteria and 12% had partial. And yet the women who had a history of sexual abuse actually were 3 times more likely to develop PTSD following the birth. So again, like I said, this is a group that's definitely more vulnerable. Now there's one other thing I want to mention, and that is the possibility of professionals being vicariously traumatized by what's going on in the birthing suite. And again, this is something we really haven't talked about very much. It's like if you talk to anybody who attends births, you do hear these stories, but this is the first study I want to show you where they've actually looked at this. Okay, so looking at vicarious traumatization of labor and delivery nurses. Now this is actually from Cheryl Beck's research, and she drew a random sample of labor and delivery nurses from the organization AWON, which is the major organization for its Association for Women's Health, Obstetric and Neonatal Nursing. Okay, so again, the organization that handles most of these nurses, or that is the organization that is the organizational home for most of the nurses in this field. Okay, and what's scary is taking a look at this. 35% of them reported moderate to severe secondary traumatic stress from being exposed to birth. Okay, so again, very, very high. And it gives you some ideas about, what are some of the things going on in the birthing suite, and, what kinds of things can professionals kind of do? I mean, we're hearing more and more sort of outcry from mothers, but we got to be thinking about, what's going on with the professionals as well. Okay, so again, you can see, 14% were in the severe secondary traumatic stress range. This is actually what one of the nurses said, and actually there were a lot of statements on this website, or on this study. They said, the physician violated her. A perfect delivery turned violent. I felt like an accomplice to a crime. The doctor treated her like a piece of dirt. After the birth of their baby, he proceeded to put his hand inside her, practically halfway up his arm, to start pulling the placenta out. I felt like I was watching a rape. Okay, so again, that's a theme you hear just sort of over and over and over again. And what Cheryl Beck actually kind of concluded too, she said, it's not the medical emergencies that lead to the trauma in the nurses. It's when the nurses feel that unnecessary procedures have been done that have been harmful to the mother and child. Okay, and that's kind of what you see in this story. Okay, so again, I get an idea that, not only are we talking about mothers that are impacted by this, but also the professionals that attend them. Okay, so with that, I'm going to actually wrap up this module. I want to just mention, my Facebook page, if you're interested in coming and taking a visit at Facebook. It's under KathleenKendall-Tackett.com. These are also my websites. And actually, particularly, I recommend looking at the Uppity Science Chick site. That's where I have a lot of my trauma and health research and my secular neuroimmunology. One other place I'd actually recommend that you look, if you're interested in knowing more about birth trauma, I have 2 articles that are available for free online. They're published in the journal Clinical Lactation. So if you go to clinicallactation.org and you look at issue 5.3, you'll see 2 articles in there looking specifically at trauma related to birth. So again, kind of going through some of the specific diagnostic categories and all that. Anyway, so I thank you for attending, and I'll see you next time.